Hello and welcome to my channel. This is Isaac Sn2ep11DARLING'S. Thank you for tuning in to my channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like and share. This is a channel where we should talk about issues concerning averting HIV and sexually transmitted infection stigma in our society. And we usually see that being positive about HIV is not necessarily being HIV positive. Thank you. Today we are going to discuss yet another opportunistic infection associated with HIV infection, and in our discussion today we'll be talking about Darling's disease. Are we together up to that point? Thank you. Welcome and let's learn. Basically, Darling's disease, or what we call Cave's disease or histoplasmosis, is a fungal infection that is usually caused by a fungi that we call Histoplasma capsulatum. This kind of fungi usually exists or loves or thrives well in the feces or in the excreta of bats and chicken. Are we together up to that point? Thank you. And a person acquires disease by inhaling the spores from this excreta, either from the soil or from the caves or the barks of trees. Are we together up to that point? Thank you. Now, when you inhale these spores, the incubation period, or the period between the time you inhale the spores and the time the symptoms present, is between 3 and 17 days. Are we together up to that point? Thank you. Now, there are various types of histoplasmosis, or what we call Darling's disease. And type 1, we have the primary pulmonary histoplasmosis. Then we have the disseminated progressive histoplasmosis. This one is usually associated with immunosuppressed individuals or AIDS patients or persons under immunosuppressive therapy. Then we have the cutaneous histoplasmosis, and lastly we have the African histoplasmosis. Are we together up to that point? Thank you. Now, these types of histoplasmosis can appear or can present together or can present individually, depending on the level of immunity status of your body. Are we together up to that point? Thank you. Now, let's start with the acute presentation. Then we continue further. For the acute presentation, someone will present with flu-like symptoms, which include present with angular stomatitis, cough, they present with hoarseness of voice, chest pain, and fever. Are we together up to that point? Thank you. Now, for these presentations, if a diagnosis is linked early with a history of travel and maybe an antigen test confirmed, treatment can be able to be achieved and complication prevented. Now, if treatment is not done, the disease may become progressive or person may present further disseminated symptoms, especially if their immunity is suppressed. Now, other symptoms that a person can present with, especially when this kind of infection is disseminated, may present with joint pains, enlargement of the liver, enlargement of the spleen, enlargement of the adrenal glands, may also present with cutaneous manifestation, that is the eruption of nodules in your lower limbs and upper limbs, which are reddish and inflamed, may also present with chorioretinitis, or the inflammation of the chorion and the retina, which have a potential of getting or leading to blindness, what we call the ocular histoplasmosis. Other presentations include patients may present enlargement of lymph nodes, what we call lymphadenopathy. Are we together up to that point? Thank you. Now, how do we come up with a diagnosis of someone who is suffering from histoplasmosis? It's simple. We can be able to do a chest x-ray whereby mass lesions can be isolated on a chest x-ray. Other diagnostic modalities that can be able to be employed in this nature, we can be able to do an antigen test, what we do call urine or blood antigen test. We can be able to do the ELISA test or the PCR test. We can be able to do a biopsy or a blood culture. Now, between the blood culture and antigen test or urine antigen test, it is preferred for the urine antigen test because they say that it's more specific and it has a greater percentage of accuracy compared to the blood culture. Are we together up to that point? Thank you. Now, to be able to get a diagnosis or to be able to get a clinical impression of someone suffering from histoplasmosis, you must be able to link them to either spelunking or visiting the caves or visiting a farmland or visiting a place that is endemic for histoplasmosis. Someone present with a cutaneous presentation, that is the erythema nodosum, and someone who has a history or present with flu-like symptoms or present with other symptoms that can be associated with this kind of infection. Are we together up to that point? Thank you. Now, we say that when you have linked this person with those kind of presentation, you can go ahead to do a confirmatory urine antigen test, which can confirm either this person has this kind of infection or it's a differential of other kind of infections. Are we together? Thank you. Now, how do we come up with a treatment plan for the person who is suffering from histoplasmosis? Basically, to be able to come up with a treatment plan, we consider whether this person is having an acute or a severe form of this kind of infection. For the non-severe histoplasmosis or non-severe Darling's disease, we consider using oral antifungal agents. The oral antifungal agent of choice, we use the itraconazole. We can also use posaconazole. For this case, fluconazole is not the most preferred kind of treatment because it's not very effective in the management of histoplasmosis. For the severe form of this kind of infection, we can be able to use amphotericin B, and in this case, the preferred amphotericin B of choice is the liposomal amphotericin B, which is usually given intravenously. Now, for the persons who are using itraconazole, it's highly advised that they get monitored for the liver function test because of the potential hepatotoxicity. Are we together up to that point? Thank you. Also, for the persons using the amphotericin B, it's highly advised that they get the renal function test regularly for their potential for renal toxicity. Are we together up to that point? Thank you. Now, let's discuss about the prevention. Remember, prevention is better than cure. Now, to be able to prevent acquiring this kind of infection, it's very important when you are visiting places that are endemic to this kind of infection, especially those visiting the caves or the wounds, and the areas they are visiting are potential for this kind of infection, always wear protective gear, either a mask or actually basically a mask, to prevent inhaling the spores of this fungal or fungi. Are we together? Thank you. Also, it's very important, if you are HIV positive, start your ARVs early or start your treatment very early to avoid compromising your immunity and getting AIDS, whereby you can be able to be suppressed, or you can be able to affected severely by a disease that can be managed otherwise by your immunity. Are we together? Also, for those on immunosuppressive therapy, it's very important for them to avoid visiting these high-risk areas that can be prone to this kind of infection. Are we together up to that point? Thank you. And this comes to the end of our discussion today. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like, and share. This is Isaac, Sn2ep11. Bye-bye.